So I'll be discussing the challenges of learning from crowdsourcing data. So crowdsourcing has an open nature, and this means that the algorithms must not rely on any other historical or supervised information. Therefore, quality control is quite difficult, and this makes improving quality after collection very important. So improving the label quality of crowdsourced labeled data is an important task. And I'll discuss two main methodologies of doing this. The first is called quality control on task designing. So this method involves using some type of quality control mechanism to regulate the behavior of labelers. And some include using checkpoints to filter low quality labelers and labels. But a problem with this method is that it relies heavily on background and historical information. Another methodology is called quality improvement after data collection. And an idea that's used with this methodology involves repeat labeling, which means that an example is labeled by different labelers. And this idea is discussed later in the reading under ground truth inference algorithms.
Hi, I'm going to be talking about a section of Article 1, specifically what is crowdsourcing. This article focuses on defining and thoroughly explaining the process of crowdsourcing and how it relates to labeling and learning models. Crowdsourcing is defined as the process of obtaining needed services, ideas, or information by seeking contributions from a large group of people, including online communities, rather than from individual groups. In other words, the core of this process is to utilize everyday internet users to label data which will be used in intelligent algorithms to solve a variety of problems. Crowdsourcing is a very useful thing in fields of AI. Researchers believe it can solve a wide range of problems that circulate around human error. Specifically, it allows large amount and variety of data to be collected quickly and efficiently. This article continues to describe specific algorithms uh, that are developed in order to use crowdsourcing in label and learning model quality. Crowdsourcing labeling refers to a blueprint of a method to map hidden features of a general topic using human intelligence, whereas learning model quality defines as prediction performance of a learning model which is trained by crowdsourcing data via an overarching algorithm. The article uses these factors to compare different algorithms which have been proposed since 2008 in order to perfect machine learning technology.
So currently we're in the technology data era. That means gaining knowledge from data is very important. That is why crowdsourcing exists to obtain labeled data. So however, one big problem of crowdsourcing is the quality of the data. So the open nature system of crowdsourcing causes uncertainty in the data that was retrieved. For an example, you can retrieve theoretical answers from crowdsourcing data, but because of the uncertainty in the data, the theoretical answers that you found might have multiple challenges. So since 2008, many models and new algorithms have been produced. However, common problems exist between these models. That is why we need research or studies to be done on these problems urgently, and the research needs to focus on these aspects specifically. More fine-grained inference methods, more learning models, more deep relationship between label quality and learning model quality, and finally, theories of learning from crowdsourced label data.
I'm going to be talking about the second article in which it explains the healthcare prediction algorithm that is biased against black patients. The study talks about the healthcare prediction algorithm showing bias against black patients. This study was done by the University of Chicago, which promoted the use of software application programs that determines who is qualified as high risk to receive healthcare. This process was done through an algorithm to predict and understand patients' social and health statuses. The studies that were conducted were shown to see patients' health and predict a risk score and compare it more directly to the actual patient's health. And it was found that black patients had a significantly poorer health than their white counterparts. I think that changing the algorithm to view other variables to predict patients' risk would avoid the patient biases in order to correct the algorithm that was initially built. The study concluded With fixing this issue will allow change in the numbers of patients admitted into the system.
Hello, my name is Jamila Bughazi, and I'll be discussing healthcare prediction algorithm that is actually biased against African American patients. So a study was conducted very recently around October 25th, 2019, so it's around a month old. And this was a study done by the University of Chicago and UC Berkeley in the journal called Science. And it found that a type of software program that determines who gets access to high risk healthcare management programs actually lets in patients that are white into the program ahead of patients that are African American and are also less healthy. Now, how is this done? Algorithms encode for racial bias because of healthcare costs to determine patient risk or who are most likely to benefit from care management programs. And because of the structural inequalities in the US healthcare system, African Americans at a given level of health they ended up generating lower costs than white people. And as a result, black patients were much sicker at a given level of the algorithm's predicted risk. And the study concluded that by fixing this racial bias, the algorithm could more than double the number of African American patients that could be automatically admitted to these programs.